Hello everybody, I hope this finds you well. Welcome to this week's video from the Chief Exec here in NHS Lanarkshire. I'll start off with the COVID numbers as I usually do, and then I'm just going to talk about some changes that we've had to put in place to deal with the extreme pressures on the service across the whole system at the moment. And then also to talk about the great response we've had from our local resilience partnership, particularly the councils who have freed up staff to support staff within the NHS. So in terms of the numbers, first of all, today we have seen new cases coming down to 716. That's quite a big reduction. It's now coming down quite a bit each day, so I'm hoping that that trend continues. We were up at over 3,000 new cases a day across Lanarkshire not that long ago, so that's pretty positive that it's down to 716. But of course, the tail of that is seen within our inpatients, really with a 1 to 2 week lag, and our inpatient number is 189 today. And if you think that at the middle of December it was down about 50, so again we've kind of seen that come down and go up again. ICU cases 4, CPAP 0 today, care home outbreak 62, and 377,000 people now vaccinated with the booster across Lanarkshire. So I think the new case numbers are dipping. It'll probably be a bit of time before we see the pressure on our hospital services ease and our GP services. However, I do feel we have now turned the corner, so that's positive. We're a bit ahead of the national position. The modelling nationally sees NHS Scotland numbers, inpatient numbers peak around the 24th, 25th of January. So I do think we'll be a wee bit ahead of that, but not too much. So hopefully there's a wee glimmer of light at the end of the tunnel. We have had a lot of workforce pressures, understandably. An awful lot of people have had COVID, people have had to isolate because other people have had COVID. So it's been quite difficult. And I know lots of you have gone above and beyond to keep the service running, both across general practice, community services and across our hospital sites. So just to say thank you for that. I know it's not easy and it's been a long haul, so we do appreciate that, and thanks again. I wanted to say a couple of things about some of the changes we've put in place over recent days. You might have seen in the media and in the staff messaging that in consultation with our GP colleagues, we've moved to level 2 service provision, and that means that where GPs cannot continue to provide level 1, and some of them may well want to continue providing level 1, they can move to essential services only. And really that is because the infrastructure that supports things like chronic disease management isn't really in place at the moment. We've got workforce deficiencies within our treatment rooms, etc., and they're really only doing things like urgent blood. So we'll review that again in a few weeks, but for the moment, where GPs need to, they can move to level 2. The other thing just to say is we have through Goal Command made the decision to move to never services, and again there's been some communication around that, and these are the services that would never stand down. So we're really just on essential services at the moment, which is an extremely pressured position. However, as I say, I am hopeful that we will begin to move out of that soon, and our workforce figures today are slightly better, so I'm hoping that we can improve our safety, improve our staffing levels, and get back up to a more normal level of service provision over the next weeks and months. I wanted just to say a thank you this morning to our local resilience partnership colleagues. So across Lanarkshire, we work as a local resilience partnership. I sit on a group, as do many colleagues across Lanarkshire, to work with North Lanarkshire Council colleagues, South Lanarkshire Council colleagues, the police, fire and rescue, and the local voluntary organisations, and also the armed forces. And over recent weeks, we had put in a request to them before Christmas really to see if they could release some staff. And I know that both North and South Lanarkshire in particular have come back with staff for us over recent days. So we're putting them through training programmes just now. So you'll see some of them out and about in our services very soon. So I wanted just to acknowledge that and to say thank you again. The armed services support that we've had within the vaccination programme has come to an end. So again, I want to formally thank those colleagues as well who've been just fantastic right the way through the pandemic. I'll end there, but again, thank you very much for taking the time to